right, Tonya told me to do the dog and pony show until we start. She had to go to the bathroom. But she just got done with a client, changed their life, taught them how to breathe. That was kind of cool. She learned some stuff about diaphragmatic breathing and stuff, but with like changing her rib cage elevation. It was pretty cool. So yeah, we'll start interviewing her in a few minutes. So just bear with us.
Let's see. Do we want to do the same thing? Tuesday at 1?
Tuesday and Thursday at 1.
All right. I think you got a package, didn't you?
I did.
Okay, so we'll just. All right, I'll get you into books here then, Patty.
How you feeling?
Good.
Yay! I like it. I like it. Good is good.
Yeah, I like your hair.
Tuesday, yeah.
Oh, we like having you here.
No, I like your hair, I said.
Oh! Well, thank you very much. I appreciate it.
Awesome. 1 o'clock. Boom.
Okay.
I'll get you. Perfect. That's going to be fun. It's May the 4th, which is kind of like a Star Wars
Man,
holiday.
Cinco de Mayo.
And Cinco de Mayo is the next day, so it's going to be fun.
May the 4th is a Star Wars day?
Yeah, like May the 4th, or Force be with you.
Oh.
May the 4th be with you.
Cool.
I'm excited. It'll be fun.
Okay, I'll see you Tuesday.
All right, see you Tuesday, Patty.
Bye, Miss Patty. Have your best day ever.
Alrighty.
The best around.
I have a friend who's I've been talking to about this place. I'm not sure if she's, after a while, she won't make an appointment, but what's entailed?
Just needs to call.
A sit down or
Yeah.
know what she's looking for?
Mm-hmm.
Yeah, just have her call. And Chris
Here you
can
go.
walk
Give
her
me
through. That's great. Oh, wait, Chris
Here
will
you
give
go.
you. Wait, hold up, Patty. Just a second.
Have her call me and I'll chat with her.
Okay.
Thank you. Have a good day. Have the best day ever. Do do do.
Take the ending starting soon off. Oh, that's not fun. Where's the chicken? All right, there we go. Okay, cool. We're good. Pew, 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 pew. All right. Where we at? Oh, why is my mom call now? I'll call you back, Mom. I love you.
Love you, Mina. Gotta go.
What's up? How you doing?
Bro, the ceiling, the sky, all is well.
I'm gonna sit and be lazy.
What's happening? What are we doing?
We're
Where do you want
chatting.
me?
That's good right there. Let me.
Take up-
Can I?
Are we?
Can I do a check real quick? Sorry.
I'm taking my mask off.
You can take your mask off. Oh yeah, it looks good.
Oh, wow.
Yay! Oh.
That's so cute.
Hi, Dr. Tonya.
Hello. Wait, where am I? What do I look at?
We're right there.
Oh, hi. Hello, everyone.
So yeah, we brought Dr. Tonya in to do our overseer physical therapy program here at Best Day. About a year? Over a year now?
Dude, it's 2 years ago.
2 years.
Yeah, it has to have been because it was a year ago. Yeah, it's 2 years. Chris and I met at a brewery.
At a brewery.
That's awesome.
Because we are not allergic to fun.
And neither one of us, both of our booths were completely empty, unmanned. Both of us were just walking from booth to booth, hanging out, chatting, meeting people, because that's really what works.
I think one of the cool things that we talked about the first time we met was how everybody in the health and wellness industry is all about healing people, but there seems like they're more about competition. Like, oh no, you need to come see me because I'm the best at what I do, and I can fix all your things. And even if you're not necessarily qualified to be that person to assess, evaluate, diagnose, whatever it may be, and that happens a lot. And just, if somebody's referred to you within, maybe that you helped their friend out, maybe you were just, as a personal trainer, maybe I was working with a client and, they were feeling great and, maybe like their back was hurting at first and then it felt better afterwards after working with me for a while. So they assumed I can do those things. So they tell their friend, hey, go see Chris because he can, fix your injuries and such. And I'm an athletic trainer, so I could potentially do an assessment and tell them, hey, I think it might be this, but I can't necessarily diagnose what that injury is, and that's where you come in as a physical therapist. So I think there needs to be more knowledge out there on what people's roles are, whether you're a massage therapist, whether you're a personal trainer, whether you're a yoga instructor, and more of a the health and wellness industry. We have all these different people that are healers, but that doesn't necessarily mean we can diagnose what we need to heal.
Right.
But we often think that we can, and a lot of them do. Like, oh, my personal trainer looked at my knee and says I need to do, X, Y, and Z. Like, no. That's not their job. That's your job.
Right.
So that's why I brought Dr. Tonya into when somebody comes in with chronic pain and injury, just bad movement patterns, whatever. I just default now to seeing Dr. Tonya. Because she's a physical therapist, and that's why we're having this conversation today, so we can explain what the heck it is a physical therapist does.
Right.
And I think there's a lot of, and even you and I have had conversations on how few people really know where your lane is, and it's a very wide lane because of your background and your education, and also legally you can diagnose people because of your license. So I just want to let people know, hey, if you have your personal trainer telling you what your injury is, that's not their place. They need to refer out to a physical therapist. That's why we brought Dr. Tonya in to do those evaluations and determine, can you fix it with movement, or do you need to go to see an orthopedic surgeon? Because that's one big thing I notice a lot is people are always like, I'm trying to not have surgery. Okay, well, who do you go to see for that? You see and a lot of times they go to see the orthopedic surgeon. I'm like, well, that's their tool set. And
hammer. Everything's going to be a nail.
Yeah, and I heard you talking with a client the other day about how you can diagnose and treat the same as an orthopedic can diagnose, but they don't treat.
Right.
Which is cool. So
Yes.
They treat by surgery, you treat by actually teaching them how to move properly.
Right, exactly. Yeah, and you bring up a lot of the points that kind of where we hit it off, 2 years ago at the Health and Wellness Fitness Expo was...
it was just a place to drink beer.
Yeah.
And there was health vendors.
Yeah, something. But I think, just to touch base with what you started this conversation with is, if you're in business, you need to keep your business running. But one of the failings in the health and wellness fitness realm of things, especially folks who are out of network or cash based in their practice, you need to keep the lights turned on, and you need to it's understandable that for people to hesitate to refer out at the risk because they might be at risk of losing that client. And I think there's a couple of reasons why people keep patients or clients that and try to resolve issues that they're not qualified to resolve, because everyone's trying to do the best they can. And so let's say you're a massage therapist, I think, or a personal trainer who are not trained or able to, in their scope of practice or training, diagnosis and treatment of musculoskeletal impairments is not included. And it's really unethical for a trainer or a massage therapist to try to diagnose and treat. Unfortunately, a lot of the clients place them in a position where they kind of are sort of asked to.
Yeah.
And what ends up happening is we have a relationship problem in the health and wellness industry where people do not have enough relationships with a diversity of professionals, where you have not only an understanding what everybody's training is, but also relationships with other people that you trust, so that you can all do what it is that you got into a helping profession to do in the first place. You got into a helping profession to help people and to be client-centered. But if you don't have enough of a network of professionals that of a variety that can actually meet the needs of the clients, regardless of wherever they are at with regard to their what's going on with them physically, you can be placed in a position where you're not doing right by the patient or the client. And so, like, you know, massage therapists, if they don't have a relationship with a physical therapist who can diagnose and treat, and I just had this happen the other day, I have it happen all the time. The client comes in, they've got like some symptoms, like say sciatic symptoms. The massage therapist in their training, they're able to assess soft tissue. So they can say, oh, you're tight in these muscle groups, and then they'll address it the best they can, but they're not getting to the cause of the symptoms. And so if you don't have a relationship with a physical therapist that you can have a conversation with, and to know that the PT's not gonna talk smack about you, for one. I know there's a lot of that out there where, oh man, that massage therapist, you know, messed up or whatever. You should never talk poorly about another professional. You should always give them a measure of grace and understand that we're in helping professions, we're doing the best we can. And so, but in the health and wellness industry, there are not enough relationships like Chris and I. Like one of the biggest things that we really hit it off about is, I don't know where I got this term, so I can't take credit for it, but co-opetition. When you are responsible for people's health, you have no business letting your ego dictate their care. No business whatsoever. If you are afraid of losing a client because you don't want to refer them, because you're afraid of losing them, you're afraid of losing the income, you're afraid of losing face, then I'm going to just be honest. Then you need to get the frick out of a helping industry, because you are not helping those people. But that has to do with relationships, and then people operating to the full scope of their licenses and their training. That doesn't necessarily happen as much as it should. And I'll be the first one to admit that the physical therapy profession is horrible at marketing and educating the public as to what it is that we do. And then we also have the physical therapists who are in the insurance-based model practice, where the insurance companies really do dictate care. They dictate the frequency, they dictate sometimes they dictate the interventions, but the frequency, duration of care is something that the insurance companies tell the PT that they have to do. And it's because they reimburse at such a low level. So if you go to an insurance-based physical therapist, they've got 30 minutes to treat somebody. They've got maybe an hour for an eval. They don't get, at no point do they ever get all the information in one sitting that they need. The insurance companies insist that you have, your manager says that you need between 9 and 11 visits per patient to be able to keep the lights on in the clinic. And so, you know, you're trying to manage all this stuff. And so physical therapists in an insurance-based setting are really fighting against a lot of challenging variables. So I'm not throwing anyone under the bus, but that's part of the reason, the main reasons why I'm an out-of-network cash-only practitioner, because now I can do exactly what it is that that client needs in that moment and have nothing else but the client's best interest at heart. And so what's fantastic about what Chris is doing here at Best Day is building an ecosystem that has all of the things, the health and wellness individuals, a network of individuals who have trust, who have relationships of trust, who understand each other's scope of practice and skills and specialties, and then freely refer and collaborate together within the network with the primary goal of treating the client to the best interest of that client. And so that's what's really unique about Best Day. It's something I've always fostered even when I've been an insurance-based physical therapist. But now, let's kind of dovetail back about, we kind of touched a little bit on what physical therapy is, but physical therapists, I'm just going to give you the nuts and bolts. Physical therapists are medical professionals who are trained to diagnose and treat neuromusculoskeletal impairments across the lifespan of people. So we are taught on the basics of how to treat from cradle to grave across all medical settings. So physical therapists can work in all medical settings, in all ages and walks of life. That is what the physical therapy degree covers, which is why, and it is now a doctorate of physical therapy that's required since I think 2015, and that's a clinical doctorate, not a PhD. There's a big difference between the two. It's often misunderstood. PhD is an academic degree, and that has to do more with research, not clinical practice. So PhD is, you can get a PhD in anything. You just have to jump through some hoops and arrange the curriculum as such. And so PhD is an academic degree that is based on research and academics, teaching, research, blah, blah, blah. A doctorate in physical therapy is a clinical doctorate, and a doctorate, the definition of a doctorate is the highest education that particular specialty has. So comparing doctorates across professions is not really, it doesn't really work, because a physical therapy doctorate will require a different level and depth and breadth of training as compared to a doctorate in like somebody who's an electrical engineer. So physical therapy doctorate, if you want to get a degree in physical therapy in a doctorate, it's a 2-year if it's accelerated, 3-year if it's a traditional program. I was just talking to a friend of mine the other day who's in electrical engineering. We were trying to kind of compare like whose doctorate was harder. And I was just like comparing like, you know, apples and elephants kind of thing. But hopefully that helps people to understand like the physical therapists are clinical doctorates. We can evaluate and treat, and so if we compare, the only medical professional that has significant overlapping skills and training is, like Chris was saying, is an orthopedic surgeon. Orthopedic surgeons and physical therapists, skilled physical therapists, have been shown to have within a 95% accuracy with diagnosis. So a skilled physical therapist and an orthopedic surgeon looking at the same patient who comes in for shoulder pain will have similar results with regard to the diagnostic process. Now, where the bifurcation comes is the surgeon can do invasive interventions, so they do not have the training in non-invasive rehabilitation. They may have some idea of it based on their specialty. Physical therapists, since we do not do invasive interventions, our entire wheelhouse is rehabilitation. Now, here's a term. Rehabilitation is actually a term that, especially I've noticed in Florida, gets thrown around. I think there's different understandings of what that term is. In the medical world, technically the term rehabilitation is actually a graduate level degree. So rehab professionals in the medical world are speech-language pathologists, occupational therapists, and physical therapists. I have a master's degree. My entry-level degree, my first degree in physical therapy was master's level, and I have a master's degree in rehab sciences. So rehabilitation is often used in less correctly, and that's another area where clients don't quite understand. Rehab in, sometimes like just fitness professionals will say, oh, I'm doing rehab on this person. Well, technically you're not if you can't diagnose. You're not rehabbing, because you can't rehab or treat a musculoskeletal injury unless you can diagnose it. And physical therapists are the only, physical therapists and orthopedic surgeons are really the only medical professionals who are trained to diagnose neuromusculoskeletal injuries, impairments. Now we can talk about chiropractics as well. They have a doctorate in chiropractics, but the difference is that all of their curriculum and everything is all overseen by the chiropractic community. And so there can be some variations in the training, variations in practice. There's a fair amount of variations in practice with physical therapy as well. Of course, I'm sure there's plenty of people who maybe not had the greatest care, or maybe have had really awesome care. But chiropractor also does not have the musculoskeletal training for rehabilitation and the treatment of musculoskeletal impairments that a physical therapist has. We're the only medical professional that has the depth and the breadth to be able to treat cradle to grave across all medical settings. So that's it. Yeah. So that's
Can chiropractors diagnose injuries?
they can, but they are not trained to the. They are not trained to nearly the. As extensively as physical therapists and orthopedists.
Gotcha.
So, and I'll just be honest, and I collaborate on a daily basis with chiropractors. I think it's a really great profession. The physical therapy profession has a lot to learn from chiropractors in the way that they practice and the way that they stand up for their profession, especially. More often than not, when I get patients who are referred by a chiropractor, which I'm proud of because that means like I have a good relationship with other professions because it's not competition, it's co-opetition, the diagnosis is not correct. Because they just do not, it's not the wheelhouse of their training. They might be in the ballpark, but they might not be right. But the data robustly shows that physical therapists and understanding of curriculum robustly demonstrates that orthopedic surgeons and physical therapists are really the most competent in diagnosing musculoskeletal impairments.
And Sean Lynch, who used to work here, he just said, don't forget about the DOs. So what is a DO?
So a doctor of osteopathy, yes, thank you, Sean, for reminding me of that. So a doctor of osteopathy ends up to be, that's a medical degree as well, so like a medical doctor. And what's really, actually I really love that, I'd forgotten about that because we talk so much about orthopedic surgeons here, is a doctor of osteopathy. They're a medical doctor, but they have more of they actually really are founded in the hands-on treatment, which is like the adjustments, like what a lot of folks think of as, a lot of people think of as like chiropractic adjustments.
Manual therapy?
Yeah, like a manual therapy. But again, DO does not, because they're a medical doctor and their training is as medical professionals, medical doctors, meaning they're doing invasive procedures. They do not have the robust training in rehab across the cradle to grave, across all the settings that a physical therapist has. But that's again, so DOs, so thanks Sean for reminding me that. So DOs and orthopedic surgeons and physical therapists all can diagnose musculoskeletal impairments, but the physical therapist is the only one who has a clinical doctorate in rehabilitation. But if I'm going to work with a DO, the DO is generally going to have a little bit more of an understanding of the rehab process. And what's really great about the DO profession is that actually early on, there was a time in physical therapy where doing manual therapy, where you're doing well, we call it, I guess in the chiropractic lexicon, they say adjustments, but we'll call it manipulations, joint manipulations. There was a time when joint manipulations done by physical therapists was looked at as outside our scope of practice. This was back like in the 70s, or 70s and earlier. But the DOs and PTs got together and started sharing knowledge because especially the Dr. Greenberg at Michigan State was one of the, or Greenman, he was one of the like the progenitors, one of the leading collaborators between physical therapists and DOs as far as manual techniques is concerned. So back in the 70s, in order to learn about manual therapy, a physical therapist had to go to New Zealand or to Australia or even the UK to be able to, the UK to be able to get manual therapy training. You couldn't get it in America. So DOs and PTs coming together and understanding their scope of practice, their overlap, their intersection of skills, and then also understanding where their skills diverge has been a big developer of the physical therapy profession in particular. But no, thanks, Sean, for bringing that up, because it's funny, I just think DOs is like, they've really helped us found our profession in a lot of ways. So,
awesome.
Yeah.
Yay, so, so one of the things that we've been doing here at Best Day, and I wanted you to kind of elaborate on the evaluation process. Now, whenever I have a new client that's referred to me, and if they check one of the boxes, something hurts, something's been hurting, chronic pain, recent surgery, whatever. There's quite a few things that pretty much anything that's not like you're perfectly functioning, which very few are.
Yeah, if there's pain.
Yeah. I'm going to send them to Dr. Tonya to do the evaluation. So I wanted you to go over why the thoroughness of your evaluation, what you cover in the evaluation, why is it important for somebody that wants to start working out with a trainer, that they start with an evaluation with you, and what are you going to cover, and why is it important to progress that person to the next level of personal training to see you first?
So if a person, because of my diagnostic ability, if a person comes to see me first, it allows everyone to do their jobs to the best of their ability, because everyone has the best information that they possibly need in order to be able to treat that client appropriately. And so, kind of on a side note a little bit, one of the biggest things that's different between one of our biggest wheelhouses as a physical therapist is being able to diagnose motor patterns which are aberrant or altered, which is a more colloquial, like a better way to say it would. Well, yeah, you got a wonky movement pattern. So basically, yeah. So the reason aside from trauma, more commonly, the more common reason people are having musculoskeletal pain is because they have a compensating motor recruitment, or they have a compensating pattern that developed for some reason a long time ago, but but has persisted past its usefulness. And so, for example, and this is where physical therapists live every day, all day long, or at least skilled physical therapists live, is understanding motor patterns. So it's not about being strong.
What's a motor pattern?
A motor pattern is how the muscles are recruited, not only the strength, but the order in which they are recruited. So I'm able to suss out what is causing let's say somebody's knee hurts. I'm able to suss out the cause of the knee pain, which has to do with the muscles being recruited or contracted or used in the wrong strength in the wrong order. And it's always, and most often, has to do with a compensating pattern that developed from something that happened a long time ago. And so that's my role, is to figure that out. And so then I can inform the trainers. They've got, their glute medius isn't kicking in early enough, and so then their knee is coming in and it's twisting it, and that's where their knee pain is coming from. So that allows the trainer to do the right thing with that client from the start. And so what Chris and I kind of talked about early on, we talked about co-opetition, and then one of the things with me is developing my practice as an out-of-network provider is really just dialing down, like setting my ego aside, dialing down and really distilling down to what is it that makes me as a physical therapist, what are my just core skills that I need to be, that has no intersection with other professionals, so that I can co-opitate with other professionals and bring them in.
If my wife's okay with that.
Right?
We're cooperating over here, Hillary. What are you doing?
We're cooperating. And so, like an insurance-based physical therapy, I might have an aide or a PT assistant helping with the patient, but I'm not going to be necessarily sending somebody over to a personal trainer until they're discharged from physical therapy, which is way too late, because the personal trainer needs a little bit of direction, and we need to be working together, not just letting somebody twist in the wind. So in answer to your question, I identify the cause of what is happening, the symptoms or the impairment that the patient has, and I inform the rest of the team as to how best in their scope of practice and skills how to address that, each in our own different way. And so I might, for instance, I got a gal who came in the other day, so now dovetailing into the thoroughness of the evaluation, my evaluations are obsessively thorough.
Yes, definitely.
It is 90 full minutes. With this, every once in a while I'll get somebody who only needs an hour. 90 full minutes, and it's stem to stern. It's head to toe. I don't care if you came in for your knee, You are paying for an evaluation, and I want to fully get all the information that I need, not only for that moment, but for down the road. Because another thing that physical therapists, our job is and our training is to think 10, 20, 30 years down the road, and how what is happening now can inform or alter how your life is in 20 years. And that's part of my training, is to understand this movement pattern or what's happening here can degrade and eventually become something that will hurt you or impair your ability to live your best life down the road. And so I've also got that long-term lifestyle, how is now going to help affect you down the road, sort of thing. So that's a little bit of a different, so that's part of the reason I do a really thorough evaluation.
So
90 minutes, do everything, and then ideally then I bring in a trainer, refer the person to a trainer as soon as possible. But if I've done a thorough evaluation, and then however long down the road the trainer is like, oh hey, so-and-so such and such is happening, and I'll be like, ooh, I remember that from the eval, it's because of blah blah blah. So I have all the info, so then the person doesn't necessarily need to come back and see me because I'm more expensive than a trainer is. And so Chris and I are very mindful of the fiscal, that's again, as a physical therapist, being mindful of the fiscal situation of the clients too. Like my job is to look at the whole person fiscally, like their lifestyle, making sure that you have the right professionals. Like I had somebody the other day, it's my job also to figure out what other professionals will be beneficial for somebody. Somebody comes in and they say that they're worried about the weight that they've gained, and then I see that's going to be impairing their ability to go through the rehabilitation process or to work with a trainer. We've got a nutritionist here that we can refer to, or whatever else it is. Like some people have stress issues, so maybe the float tank would be a good idea, or maybe a massage therapist. And so that's also my job too, is to kind of say, hey, we've I'm sort of the hub and the wheel, and then the rest of the community is kind of the spokes. So that's kind of where I fit in the best day ecosystem, if that makes sense.
So getting back to the evals, and you said if they're here for a knee issue, why would you be looking at hips? Why would you be looking at their spine, their shoulders, their head? Because I'll kind of summarize, because you are so thorough, and you and I both agree that one joint affects every other joint. So why is that important for you to go all the way up and down the body to rehab a knee?
Yeah, well, because so that I can discern the actual cause, because the symptomatic tissues are the vast majority of the time,
so symptomatic tissue meaning the pissed off thing that hurts?
Pain. The place where you're having pain, the place where you're having symptoms, is more often than not, is the victim, not the perpetrator. The perpetrator is usually somewhere else, and it's causing unbalanced, uncool forces through the tissue that is breaking down and causing you pain. So my job is to look elsewhere, find the source of the stress to the injured tissue, and then correct that motor pattern and work from that perspective. So the reason my evaluations are so thorough is because my job is to find and my training is unique in that I find the cause, but then I also am thinking further down the road, because when you come in here, I do an eval, you start working with a trainer, it's highly possible that as you do more, people are kind of like onions, something else will pop up once you start doing more, you're lifting heavier, you're moving more, something that had been not symptomatic or not challenged that you weren't really aware of might become symptomatic down the road because you're doing more. And if I do a really thorough eval, I've already kind of got that, I've seen it. I've kind of seen that, and then I can advise appropriately. So it just really makes the process of participation a great deal more efficient, personalized, effective, and the chance for relapse or re-injury is significantly reduced as a result of my thoroughness.
That's a great explanation. So one of the reasons that I've gotten a lot of my clients in the past is because I've helped other clients of mine not need surgery. So now, when I think one time you were working with somebody and you said, I think you used the phrase permission to move. And there's so many times where I have somebody that's so afraid to do anything because in the past they've aggravated it worse by moving, or they've just, they had to stop moving because it hurt too much.
That's a good question.
So when somebody's like, okay, I've seen all these specialists or all these people, and now we know that they probably shouldn't be getting diagnostics from some of the people they've been seeing.
Right. Who are well-meaning and
yes,
just
yes.
being put in a tough place.
But let's say they're like, okay, I've seen everybody. My next source of information is an orthopedic surgeon. That usually seems to be, okay, I've exhausted all my other alternatives. I've done heat therapy and ultrasound and massage and corrective exercise, and even saw a physical therapist that didn't, was in one of the systems that didn't help them, unfortunately. And they were finally said, okay, I'm ready to go see an orthopedic surgeon because I've exhausted all my other options. Things still hurt. So when you start seeing people that maybe that are saying, okay, ortho or physical therapist, and you all of a sudden start teaching them how, like, hey, you need to move more. You need to actually exercise. You actually need to do squats and go for walks. And in their head, they're probably thinking, it hurts when I move. Why? But you generally tell people it's okay. You need to move more. You need to move more. And we always hear this: movement is extra. Movement is medicine.
Motion is lotion.
Motion is lotion.
Yeah.
And it is so true. But if I don't have an understanding of the complex systems in my body and the anatomy of my knee, I probably don't know if I should be moving because I don't want to hurt myself, and
right.
I don't want to increase my chances of maybe doing something worse that might need surgery. So when you have somebody that comes to you and they're like, I think I need surgery, and then you're going through the evaluation, and then by the 30 minutes into it, you just start teaching them that they need to do this and this and this and move this way and do this more and do that. And by the time they leave, they're feeling better and they're starting to use those practices at home for homework assignments. And then all of a sudden, surgery isn't a thing anymore because they're feeling better.
Right.
So movement is medicine. You generally tell people they need to move more often. Kind of go into the science a little bit, maybe some of the data of why oftentimes historically we opt for surgery and we don't need it.
Right.
And movement will generally fix the issue, or at least decrease the chance of them needing surgery, even though they are like, I gotta have surgery.
Yeah, because they just haven't had the right care.
So I guess that's definitely a bunch of questions, but why is movement what
So
we need?
important, yeah.
And why can it be a surgical alternative?
Right. Well, our bodies are made to move, and we need, a strong body is a healthy body. But you need to be strong in the right places. And so, yeah, this is a really good topic to kind of bring up. Is again, my training as a doctor in physical therapy is I am trained in ruling in or out the need for surgery by the diagnostic tests that I'm able to do. And so I can advise as to whether or not the way something is presenting with a person with regard to the pattern, the motor pattern, the strength, the range of motion, their symptomology, et cetera, whether or not surgery, they are a likely candidate for surgery. And so that is well within my scope of practice. It's my wheelhouse. It's a similar thing that an orthopedic surgeon will do. It depends on, there are plenty of really good orthopedic surgeons or DOs who can diagnose. It just depends on where they're more of surgery oriented, or whether or not they're the more conservative care. But everyone should always, before surgery, have a bout of really skilled conservative care, which means you're getting the motor patterns, your muscle strength, your range of motion, the cause of the symptoms or the pain that a person is having identified and addressed competently and appropriately. And that's what a physical therapist is trained to do. As far as the movement perspective, and most people do know that they feel better if they move, but consistently the mistakes people make is they either move not enough or they move too much. And so those both contribute to a relapsing of their symptoms and the feeling that, oh, well, I guess I've tried everything and I might as well just go for surgery. So let's say somebody sprains their ankle, okay, healing tissues need to be moving during the healing process in the way that those tissues are going to be asked to move once they're healed. So gone are the days of recommending rest outside of the acute stage of an injury. And even during rest, if you sprain your ankle and you can't weight bear, you can barely weight bear on it, you still need to be moving it gently, even during the first few days where it's the most painful and swollen. Because those tissues that are healing, your body, let's say you've got some torn tissue and they're like this, your body in the healing process is creating new collagen fibers to help those tissues that have been torn grow together, bridge together, and have their integrity restored. Without movement, because your body just creates collagen fibers and just spits them out haphazardly. So you end up kind of like this. So let's say in the context of that sprained ankle, that ligament, those tissues that have been torn, you get haphazard collagen fibers. Without a properly graded and dosed movement, which would be not too much and not too little, that you just have haphazard arrangement of that scar tissue. And then scar tissue is actually weaker than tissue that has not, that has not been damaged. Scar tissue is weaker. It has and it also is more fragile at the same time, and it doesn't have the same range of motion. So in the context of that sprained ankle, if you're moving that ankle gently through even the first 3 days, because you want its pain-free range of motion, we're going to be asking you to be moving that ankle around and walking and loading it to the amount that you can manage, so as to prevent the compensating patterns and the side effects that happen that can be long-standing with regard to rest. So we've got our haphazard collagen fibers from the healing tissue. Gentle movement will create order. So gentle movement in the way that you're going to want those tissues to be working. So then ideally what happens by the time those tissues are healed, which is 4 to 6 weeks, all tissue heals in 4 to 6 weeks. If you're having symptoms after 4 to 6 weeks, it's not because the tissue is damaged. That is, remind me of that. That's one of the most misunderstood things. That's one of the most misunderstood factors with regard to musculoskeletal injuries and the pain sciences, and that could be like an entire 4 other podcasts. But back to gentle movement, we got our sprained ankle, collagen fibers laid down haphazardly, kind of jankily, and then gentle movement that's dosed and graded appropriately, which is what a physical therapist is trained to do, to determine how much is too much, how much is not enough. And then now the tissues are healed, and you've got beautiful, aligned, properly functioning, strong, proper range of motion tissues, and you can actually get back to what it is that you're going to do. More often than not, people sprain their ankle, somebody tells them to stay off of it and do nothing. Let's just think about a client we had who was recommended by a professional. It was actually somebody who should have known better, told them to stay off of it. A year later, the person has actual PTSD with regard to the injury, and it was just really unfortunate because it was too much rest. And so now you rest. Now we've got this. So let's say you're a runner, you sprain your ankle out in the mountains. Now, mind you, not here in Florida.
What's a mountain?
I know, right? I moved here from
Mount Dora? I think
Yeah.
there's a mountain there.
I moved here from Oregon, where I was out in the mountains a lot, and I would get this with my runners. So they take like somebody tells them to take time off. So now you've got your tissues that are like this, and then as an athlete, people tend to, or just a person, you got kids or your life, you take a week off or 2 weeks off, and you do nothing. You sit on the couch. What are your tissues adapting to if you're sitting on the couch?
That?
Your tissues are adapting to sitting on the couch. And then, so here you are, couch sitting tissues, adaptation. Now, you get up and you just go back to your life. You're tearing those tissues loose because they adapted to this sitting on the couch. And then now you've got symptomatic tissues because you asked them to do something that they hadn't been prepared to do while they were healing. So healing tissues need to be treated properly. They need to move not too much, and they need to move not enough. So rest is a 4-letter word. It is appropriate when it's appropriate. but more often than not, it causes a whole slew of issues. Like if you have an acute injury, which it's this example, but then if it's not an acute injury, meaning like let's say you have just a recurrence of your chronic low back pain and you stay in bed for 3 weeks because somebody who's not qualified told you that you're supposed to stay in bed for 3 weeks. Now what has also happened is you've lost your base level of fitness, which your base level of fitness is not just how you're feeling big and strong and able to function. Your body, your bones are held together by little muscles that create stability, and they prevent shearing forces. Now I'm going on a tangent. But one of the biggest things that happens with folks, especially with low back pain, is, and anything spine related, is shear, and well, the knee. Okay, anyhow, pain in joints. And the spine are a bunch of joints. Shearing, which is one surface sliding on the other. So this is shearing in one plane, but more often than not, we have shearing with 2 planes. So we got shearing with rotation, which causes tissue breakdown, because now you have just a lot of pressure on one little area where it's spinning and shearing. And so if your muscles are not strong in all the right places, your foundational muscles that hold the bones together, if they're not properly strong, you get shearing forces and rotation, which can cause your symptoms again. And so in low back pain especially, folks who are not moving properly, they don't have the best range of motion, they don't have strength in the right places, they don't have the appropriate motor pattern. That's the cause of the recurrence of the symptoms, not because your herniated disc is actually redamaged. And that's in the pain science world, that's one of the biggest things that we've discovered, is that just because you're having symptoms or pain doesn't mean that there's tissue damage. And that's, again, physical therapists are trained and competent and able to diagnose whether or not the pain that you're feeling is neurological, meaning your central nervous system or your brain is interpreting it as dangerous when it really isn't dangerous. And again, we should do a pain science podcast because it's just absolutely fascinating. And one of the biggest advancements that has happened in the medical world and the physical therapy world over the last 10 or 15 years is pain sciences and understanding how your central nervous system, AKA your brain, remodels in a response to stress, which would be, stress could be defined as like emotional stress or physical stress, meaning an injury. And that's a whole complex. But I can't remember if I answered your question, but hopefully.
I forgot what question was.
Yeah, hopefully that was helpful, but I think that's just really important. Oh, why you need to move.
Yes,
so if you move too much and your muscles if you move too much, and your muscles aren't recruiting properly and you're creating shear and rotation through those injured tissues, you're going to reproduce your symptoms because the forces upon those tissues are not correct and they're causing stress. And that's if you move too much in the wrong way. If you move too little, then you're creating more weakness in the wrong places, and you end up kind of in the same place. But hopefully, I think we dovetailed
moral
back
of the
around.
story is the Goldilocks zone.
Yes.
Not too much,
Yes,
not too little,
exactly.
just right. But that just right, sometimes people don't know where that is.
Most people don't know where that is, and that's where physical therapist's job.
Moral of the story,
is.
she knows where Goldilocks is.
I will find Goldilocks for you. And the best part of it is like, I don't need to be all up in your, like, I do a really good thorough eval, and then send you off to other people. Like, so it's just the best of all worlds, because I get to do exactly what I'm really good at and what is specifically in the physical therapist wheelhouse. I get to do that all day long, specifically just the stuff that's just the nuts and bolts and just really just fires me up. And I don't have to do the stuff and I don't mean have to, but in the clinic, in the insurance-based, you have to sit and watch people perform their home exercises. That's not my wheelhouse. Other people can go through exercises with folks, and there's no need. I'm just going to say it's a waste. Like when there's other people who really get fired up about doing exercises. Like I get fired up about all of it, but not all PTs are that way. But what's great about Best Day is we all get to just live where we just thrive. And we're in our specialty, in our scope of practice, in what fires us up, and what makes us excited, makes us having wanted to get into the professions that we're in the first place. So we really just get to do what we love and are really good at, and co-optate outside of that.
Yeah, and that's it's been a huge, and you talked about people running businesses and being healers, and as a business owner, I worry about, the safety of my clients and their progress, and because a happy client's going to keep coming back. So if I rely on one of my trainers or myself to figure out what's going on with them because they're in pain, or they come to me, they were referred from a friend that we helped out, I now have to stress about, am I doing the right things? Is that trainer going to do the right movements with them or give them the right exercises? And I used to try to figure it out. I need to be honest, because, again, I'm a business owner. I want to keep that client.
Yeah.
So let's be brutally honest. I don't want to lose that client.
Right.
And I didn't have a network to refer people.
Right.
And for years, I didn't have a physical therapist to refer out to.
Yeah.
I was always looking for a good one.
Yeah.
So now that, I do have a great referral network of physical therapists and chiropractors and, specialists in their lane that I know, and nutritionists, if they want to ask me about nutrition, I know about how I like to eat and what's healthy for me, but I don't know all the data and science that's going to work for that specific person like a nutritionist would. So now it's just default. See Tonya, unless you're a perfectly perfect athlete with no issues, and we can just kick the shit out of you for an hour, and then we don't have to worry about damage anything. It's usually that's few and far between, because most people do have
There's something.
wonky
movement patterns.
Yeah.
Wait, not to interrupt, but I'll interrupt. One of the things, too, that in the physical therapy profession is because direct access is allowed in all 50 states, so you can go to a physical therapist.
What's direct access
Direct access means you can go to a physical therapist without a referral.
Okay.
And so historically, you needed to go to a general practitioner or somebody, an MD or somebody, for a referral to a physical therapist. Otherwise, either from an insurance perspective, they wouldn't reimburse, or from a legal perspective, like you couldn't treat. But all 50 states have some form of direct access. So actually, I'm glad that you kind of brought that up. Let's see, where was I going with that? So direct access, physical therapist. Now I completely lost the train of thought as to why I interrupted you in the first place. What were you talking about?
We were talking about why I default to having people see you before they start a personal training program, and why I might make that my common standard operating procedure going forward.
Yes. Okay. Now I remember where I was going with that. Is the physical therapy profession is now, because of direct access, because we don't have that gatekeeper model, is just getting people to realize that a physical therapist should be your physical therapist for life. And that's a little bit about what our ecosystem, the ecosystem you're building here, is. This is your best day fitness for life. Like you're building enough of a robust, so anything health and fitness wise, people can come here for. And so that's, again, kind of dovetailing back about my super thorough evaluation. I get enough information about somebody that, that can inform something that happens, like the person can come in for like a month or two, and then 4 months down the road, something might happen. Then you come back here. And we don't have to redo the eval again, because I've already met you, I already know you. It makes everything more efficient, because how many people have gone through the medical model? You go to the MD, you got something going on, you tell them your story. Well, no, first you have to tell like the intake nurse the story, the MA, the medical assistant, you tell them their story. And then the doctor comes in, and you tell them your story. Or maybe the PA comes in, you tell them the story. You tell the same freaking story 94 times, but nobody ever gets the full story. And so being able to come back to that same practitioner and being your physical therapist for life, like with the model of like the dentist. You don't go to a different dentist every time you have something going on with your teeth. They keep all your information, it's cumulative, and so that it makes all the visits subsequent visits more personalized, more efficient, and more effective because you have all the information that you need. And that's another good thing about our ecosystem here is that we talk amongst ourselves with, we tell you with permission, of course. So we're going to talk about you behind your back so that we can all best do our job. So Chris might be having a conversation. I might do an eval and get a lot of information from somebody, but then we all forget to say things to our medical professionals that we go to see. And so the person then might go see Chris, and Chris gets a little bit of information from them, and Chris will be like, oh, did you know blah, blah, blah? Did you know that patient fell off of a cruise ship back when she was 18? I'll be like, no, I didn't know that. And actually, believe it or not, that could be informative as to what it is that's going on with that person. So we all share these little nuggets of information and get to fully know the people who come in here that we are tasked to help. And the more information, the more thorough, comprehensive, and personalized information that we have, the more comprehensively, personally, and effectively we can provide care.
And also shortens
And
the amount of time that they
it cuts
are in.
costs. It cuts costs. Like, we're as efficient as possible. You see me as little as possible because I am more expensive. And so that's the whole model, is how do we cut down the costs overall? Yes, it might be a little bit to start off with, but at the end of the day, with my business, it's extremely rare that somebody ends up paying more than they would have, or even close to what they would have if they were gone to an insurance-based professional, because the frequency of visits and the duration of visits are significantly less when you're able to be comprehensive and personalized, which is one of the biggest things about, biggest benefits of being a part, like, you're a part of the Best Day family, like, you're a part of the Best Day ecosystem. You don't just come in here and you're part of the, you go and do some personal training. Like, we get to know who it is that you are, and we're going to support you and reduce the cost and the overall frustration or stress, or we're going to reduce the cost, we're going to reduce the amount of time it takes to get back to your life, and we're going to enhance your life for as long as you live in the area. And even then, there are virtual visits that are available. So you're stuck with us. It's a long-term, we look at all our clients as long-term relationships.
Excellent. Very, very
PT
good.
for life.
Very good synopsis of what a physical therapist does. I'm an athletic trainer, so we work one-on-one with physical therapists, so I understand what you do, but being able to explain it to somebody that doesn't know a difference between a physical therapist and a chiro and whatever, and a massage therapist, a lot of people don't. And that's not anything. It's just our culture. We don't really. A
lot of physical therapists don't know what they do.
Yeah.
Or they can't explain it very well because
Right.
they don't have to, because they just go to work and the insurance company sends people to them. They're not here like building businesses, making relationships, and any of that. So hopefully this is helpful.
Yeah, I just wanted to kind of provide this information for people that are, thinking about coming in, or maybe they've been locked up in their house for a year and they're ready to start coming back again, and their back's been bothering them.
Don't do too much, because that's what you might do.
Yeah,
Too
there's
much.
a lot of that, a lot of too much or not enough. And
Yeah.
we got to find that Goldilocks zone.
Goldilocks. I like that.
But
Goldilocks.
Goldilocks needs to, eventually that too much needs to be just right, So we're progressively and safely and trying to figure out how to grow that Goldilocks zone and how you can do it as cheaply as possible, which see you early and then start moving more. If you need a trainer to keep you accountable, start having, personal training. We obviously recommend that. What can clients do better to help you help them, says Sean.
Come in earlier.
Come in earlier.
Come in earlier. Don't just come in. Like, get in.
Learn some shit.
Just come in earlier. That's one of the best things that you can help us. Don't wait. Don't be like, oh, something big and bad needs to happen. If you want to get started on our exercise program and you haven't exercised in a while, then just come in and get screened, because if I'm able to do an evaluation on you, I'm going to be able to identify the at-risk movements or the at-risk activities, meaning the ones that could cause you to become injured or demotivated or that's my job, is to be like, okay, to find that Goldilocks zone. So even if you're asymptomatic, you have no symptoms, if you've been down for a while and you want to get back into an exercise program, then that's the appropriate path is to come through physical therapy, because I can diagnose and figure out what that Goldilocks zone is. But the most consistent frustration that we all have is that people didn't come soon enough. They've been to 12 other professionals over 10 years. Their life has been significantly affected in a negative way. And sometimes it breaks my heart. It's like, why didn't I meet you 5 years ago? I'm glad the person is here now, but it happens. And I think that has to do with like that out of network place, is just you get the people who've just, every day I wish I'd seen somebody earlier, because their life wouldn't have tanked as much if they'd seen me a long time ago. So come in sooner than later.
Yeah,
and if you're worried about money, there's a way to figure it out. There's a way to figure it out. Like just talking to somebody the other day, she's got an $80 copay for physical therapy for an insurance-based. Do the math. 3 times a week for 6 weeks at $80 a pop. Or one eval with me, and then I see him 2 other times in the space of 6 weeks.
Yeah.
It's going to be less expensive and more effective. We are sensitive to finances, and we will figure stuff out.
Humans,
but just come in sooner than later.
Humans are genetically like short-term thinkers anyway.
Yeah, and don't waste your money with other. And you're not doing other professionals any good by putting them in a position where they're not able to do what it is that they do well.
Yeah.
So asking somebody who's just not trained or qualified to do something that they're not trained or qualified to do is really unfair to them, and you're not going to get good care. Mm-hmm. And so come in sooner.
And then Sean had asked, Danielle had a question. What is your take on PTs and chronic low back pain? Do you advocate that pain neuroscience education can be taught to both personal trainers and physical therapists?
Oh, absolutely. Yeah, were you listening a little while ago when I was talking? Yeah, we need to. This is an indication we need to have a pain neuroscience education podcast and talk about that. No, the principles of pain neuroscience, that's probably one of the things to be proud of as a physical therapist, because physical therapists have led the charge in the research in pain neuroscience education, which basically means how your brain remodels and responds and interprets information from your body. And there's a whole lot of podcasts we've got on that one. But yes, there is actually we talk about pain neuroscience education every single day. Personal trainers can be doing it, physical therapist assistants, massage therapists. That's actually one of the things that we do is we integrate the principles of pain neuroscience education by talking amongst ourselves and making sure our messaging to the clients is consistent and beneficial and in keeping with what it is that's going on with that particular patient. And so in my graduate program that I'm in right now, it's fun because I've been doing a re-dive into pain neuroscience education. I've even dove into it a bajillion times. And we're looking at where that fits in. There's a lot of research with the psychosocial integration of pain neuroscience in the sports world with regard to from a team perspective, and that integrates in all the people. So now there's research that shows that, just like you were saying, multiple professions across the board can be integrating pain neuroscience, not just physical therapists, but personal trainers. Our nutritionist. I will talk with a nutritionist and say, just make sure that we're using this type of language, this type of messaging with this type of person, with this particular person. And that's pain neuroscience education. But yeah, no, that's a fantastic question, and we're going to need to do a pain neuroscience education podcast for sure, just to kind of, because that sounds like a technical term, but it really is not that technical.
I have to do.
It's very intuitive.
Like most professions, I have continuing education, and I do so many of them. I oftentimes forget about the ones I've done, but I remember I did an 1.5-hour lecture with this. It was a physical therapist who specialized in pain science and the pain science of it all. And I learned, I still can it changed my whole perspective on the way I operate when it comes to myself for talking to clients. And it was a game changer.
It's absolutely, because it changes. I'm sorry to interrupt, but like, just for anyone interested in pain neuroscience education, I would recommend that you go to YouTube and you Google Lorimer Mosley, Lorimer Mosley, Lorimer Mosley,
Lorime.
Why Things Hurt. He is one of the leading researchers in pain neuroscience education, or pain sciences, and it's so interesting how professionals who research something will often end up in the situation that is the subject of their research. And I'm just going to leave it at that. And so it's an entertaining clip. YouTube, it's like TEDx or TEDMed or something. And it is absolutely entertaining and really informative as to what the pain sciences are and how the central nervous system reorders. And that can be really helpful. It's something that I have a lot of my chronic pain, or people who have chronic pain, to watch, because it helps you understand how our brains are just so adjustable and adaptable. And yes, they adjust and adapt, but sometimes the adjusting and adapting, that just like you're limping. You limped, and because that helped the tissue be guarded, but if you keep that limping pattern, that ends up causing trouble down the road. It's the same thing with your pain sciences. The way your central nervous system remodels in its response to stimuli, or pain or an injury, if that stays, then that can become problematic. And that's especially with chronic low back pain. That's where a lot of where the bulk of the research is coming from with the pain sciences. But Lorimer Mosley, Why Things Hurt, highly recommend it.
Cool.
That was a really great question. Who was that asked that?
Danielle.
Danielle, thank you so much for that question. That's fantastic.
We got to invite the Lynches to every conversation. They ask all kinds of good questions.
Heck yeah. I know there's so much to talk about. It's good to have people be like, focus.
Yeah.
Bring it in, girl.
Cool. So I think we went over everything. So if anybody has any questions, feel free to reach out to us. You can message us, call us. We're always excited to teach.
Come in.
Yeah. And then if you're on the fence, just come in and get an evaluation, and we'll go from there. But thank you everyone for joining, the ones that did, and anybody that checks us out this video later. Hit us up in the messages even after the video, and we can answer them as we get them. Thank you, everyone.
Thank you.
Namaste. Have your best day ever.
Best day ever.